want to say Renee Boss wrote something about this, how like parents want to hear a recommendation, but they don't necessarily want to follow it. They just want to hear what you think is quote unquote right. Um, and I ask parents, like, would it actually be helpful if I tell you what I think we need to do? And some people are like, yeah, I don't think I'm going to do it anyway, but like, sure, like, go ahead and tell me. And then I'm like, oh, this is going to be fun. And some people are like, really, no, just guide me, just tell me what to do. And I think that's when we freeze. I'll be very honest. I think a lot of us are like, oh, that feels really heavy. Like now the burden's on me to actually decide what's going to happen. I'm not sure everyone's super prepared for that either. Um, there's some decisions that I think we're comfortable sort of guiding people through, like whether to place a tracheostomy in a baby who's now been extubated 6 times and couldn't come off the vent, and the family really wants a baby to take home. They really want a survivor, and they are well counseled about tracheostomy and living with that technology. But they're still like, oh, I don't know, maybe just one more trial to extubate, maybe more steroids. And I think most people would be like, no, if you're really asking our recommendation is to go ahead and schedule a tracheostomy. Like, I think most people who practice in that space, and I come from a NICU that does a lot of that type of care, that's easy to give. And again, we often work in consensus. Like we have a program of people who just talk about chronic mechanical vent support. And so we come together, we say, yep, this is a decision, let's do it. But other things are harder. Like if the family comes and says, should we do this next thing, whatever the thing is, or is it really time to say goodbye? I think most clinicians would feel incredible weight and responsibility to say, yeah, I think it's time. And I think if you don't struggle with that, something's wrong. Like you should struggle with that. You should struggle with that recommendation to say, yeah, I really think this is the end of the road. I think if you have a relationship with people, you can maybe easier kind of give a recommendation, accept the responsibility of it. But if you're just there for, a week of service as a neonatologist, it should feel heavy. You should talk to your partners. You should talk to the family more. I think I noticed that in my practice, we have a lot of really complex chronic babies in our NICU. And a lot of the time, there's conversations about like guiding the family to kind of accept that this is not going to work out. Lots of family meetings, lots of sort of hedging and hemming about, I don't really know, it's not going to work. But when it's actually time to do it, we struggle. Because there's always someone who says, but what about this other thing? Sometimes it's a surgeon, I'll be honest, to be like, I don't know, maybe we can just try this one other thing. And people are like, oh, maybe we should. And so I find it kind of like ironic. Then we push the parents a lot to decision making when we actually struggle with it ourselves and don't often have a clear sense of a consensus of what the right thing to do, not just sort of the life and death stuff, but just even the surgical stuff, the next sort of ICU stuff.
Well, it's maybe not ironic. I mean, it's ironic, but it's also like it's one like the perception is I'm doing my job. My job is to make offer options. It's not my job to make the decision.
Yeah.
That's the parent's job.
Right. And that's so flawed too, right? But then there are other people who say my job is to help them decide, but in this very sort of truncated, quick way. Like I've recognized this is not going to work out, and now I need them to get there as quick as I got there. Like that's flawed too, right? Like, yes, it's my job to guide them, but it might take 3 months. I don't think it's a one meeting with a new palliative care consultant about goals of care that's going to get you to that decision.